I began responding to the situation by completing a comprehensive physical assessment on Amy. My preceptor and I pushed 10 milligrams of morphine over 5 minutes to help aid in any pain that she had been feeling. We hung 2 liters of warm normal saline to help increase her blood pressure. We cleansed the 3 lacerations on her neck using normal saline and applied Tegaderm to the wounds to prevent infection and promote healing. After Amy regained consciousness, I completed a CNS assessment and Glasgow Coma Scale to ensure that there was no damage to her neurological system. I start reflecting in action. I notice that I am now confident in beginning a comprehensive psychiatric assessment, as I have referred to the best practice guidelines on the assessment and care of adults at risk for suicidal ideation and behavior. I am able to identify potentially hazardous items in the hospital, such as clothing, cords, linen, tubing, oxygen therapy devices, and so on, that I need to be cautious of giving to Amy. I am able to reflect on the information that I know regarding her past and can identify factors that may have contributed to the emotional escalation that led to this sad circumstance. I start to worry for Amy as I remember the research surrounding the effects that stigma can have on both the patient and their family after suicidal attempts. I will ensure that I approach the family in a non-judgmental manner and display active listening and open body language to obtain a therapeutic nurse-client relationship. Even though I plan to complete a psychiatric assessment on Amy, I still feel that a more specialized approach to assessing her mental health needs is crucial. Therefore, I will collaborate with the mental health nurse on call. In addition, I begin to recognize the need for interprofessional collaboration with the social worker on the floor, as Amy will benefit from community resources upon her discharge. As I begin to reflect on action, I start to wonder if other nurses find it as difficult as I did to care for a patient who self-harms. After doing some research, I discovered a qualitative study on nurses' experience caring for patients who self-harm, and it identified that indeed many nurses feel burdened with feelings of fear for their patient, frustration for their situation, and abandonment for support. As I shared these results with my preceptor, I found it reassuring that I am not the only one who struggles in these situations, and find comfort in having her support and guidance to overcome these insecure feelings.